Okay, this next part is also an award, if you will, that we get to do periodically, and these are the Public Health Champion Awards, what I used to call the Public Health Heroes Awards. And we have 3 this month. Lori Seago and Diana May and the entire Emergency Incident Support Team. And I think there's a number of you back here. So Susan, would you mind making some comments about these 3 award winners?
Sure. As everyone has heard time and time again, public health, we accomplish our work through partnerships and collaboration. And we have numerous different heroes and public health champions in the community. And we have 3 areas that we're going to recognize today. And after we recognize each public health champion, then I'll ask you to come up here and say a few words if you would like to. And then after that, then we'll take photos with Board of Health members. And so the first Public Health Champion Award, Lori Seago, if you could come up, please. Lori Seago has been supporting public health as our attorney for, I believe, 11 or 13 years, Lori.
Oh,
you probably
it
more
may
accurate.
feel like that, but it's probably like 6 or 7.
Okay. Yeah, it's probably
You've been
like
twice as busy. There you go.
this past year. And Lori has just done a tremendous job pre-COVID on so many different matters that include public health and the Board of Health. But this past year has been incredible. And you know, we joke a lot because we're used to everyone who's been in the response, you know, texting, calling multiple times, night or day, weekends, and just getting the job done. And Lori, in the beginning of the COVID response, if you remember how many policy changes there were, and we also faced a lot of the unknown. And Lori was our attorney that was helping to translate all of the policies to help us understand what it meant here locally, so then we can in turn inform the business community and all of the entities that were impacted, like you know, what are the requirements, and not necessarily, so we have the communicable disease you know, area and the data team, but from a legal perspective, really trying to understand what does this mean so we could provide good, accurate information and be very responsive, whether, you know, through different platforms. And you know, we had a lot of technical questions, and Lori supported us through that. And another key area was when we went through variances to help businesses allow for more gradual opening or to loosen the restrictions beyond what the state had required. And Lori helped lead all of those variances. And there was different multiple sectors, you know, going to the Board of County Commissioners, or whether it was City Council, Colorado Springs City Council, and helping to navigate all of that for us. And so that was tremendous. And if that's not enough in a pandemic, she helped us, the Board of Health, with a purchase of a new building in southeast El Paso County. And I know when I went to Dr. Turbish with the idea, she's like, what are you thinking, Susan? In a pandemic, but it's like, we need this. And Lori is the person that navigated, you know, all of the real estate rules and really not supported the Board of Health, but really led that effort with all of the paperwork and the rules and all of those details. And that was phenomenal, Lori. And I can't tell you how much paperwork she's went through for communication for me. On my desk, I mean, there was always lots of communication my way, and she handled all of that. And you're just phenomenal. So you are our public health champion. And Mary Ritchie is now our attorney, and she's transitioning, and Lori's going to be working on some other aspects of the county, but you are a public health champion. And we just appreciate all of the work that you've done on behalf of the board and for our team. So thank you.
Let me add to that, Lori, because I personally benefited from your expertise and service. And, you know, I haven't bought a commercial building before. At least not like that. And this whole process of going through the purchase of that building in Fountain and Southeast for our additional site for our public health department turned out to be genius. And I always knew it was important to have a lawyer by your side to avoid the missteps, but it never became more clear to me than through this episode in purchasing the building, how important it was step by step. And very, I'm sure it was tedious, but the detail and the let's think about this. I just really appreciate you and all the trouble that you helped us avoid and from your dedication. So thank you. We really do appreciate you.
Thank you.
And I don't know.
Any other board member comments? If not, go ahead, Lori, please.
Thank you very much. This means a lot to me. When I first started representing public health about 6 or 7 years ago, it was during a time when public health was transitioning from private outside counsel to receiving the services of the county attorney's office. So I was the first attorney to do that. And fortunately, I think it's gone pretty well. And I think we've built a pretty strong partnership between my office and Public Health Fee Agency, as well as the Board of Health. So I'm pretty proud of that. It's been a tremendous learning experience. It's truly been a privilege, particularly during the pandemic, to help those that are doing the actual work. Any small part I could play, I'm really privileged and humbled to have done that. And I just want Susan and Deanne and the Board of Health to know that I've worked for the county since 1998. And the passion that your staff has for the services they provide and the compassion that they have for those that they serve is unmatched. And it's just been a real privilege. Thank you.
Thank you. Thank you very much.
We'll give you the star here soon.
In a minute, yeah.
And Miss Diana May, your turn.
Oh,
And so Diana May, for those that do not know her or haven't had the pleasure, she serves as El Paso County's attorney, and she leads the county attorney's office. And I've had so many interactions with Diana over the years, and much more so during the past 15 months. And Diana is an amazing leader. She is so strategic, very responsive, always there. It does not matter if it's 6 a.m. or 11 p.m. And these are not small issues. These
Sounds
are
like you.
Issues that we bring forward. They're not small, and they're significant, and now we have to work through. But Diana has taken the initiative with our response to not be reactive, but to be a leader. And she has helped initiate our schools group, which is also led by our community disease team, Haley Zachary, as well as Jenny Best and Deanne Ryberg. And that's, with 17 different school districts and also charter schools, that's enormous. And to navigate all of that. And she has not skipped a beat, but she has really been so strategic and so helpful. And also numerous times our liaison also with some of the superintendents, and then also initiating meetings with the governor's office and the chief of staff for El Paso County's voice to be heard. But whether it's variances or being there for businesses or athletic clubs, or the jail or the court system. Another area that I forgot to mention with Lori, that also Diana helped spearhead for us is putting a procedure together to work on enforcement. And so we outlined that. Diana helped call all of the police chiefs from all of the different municipalities and towns and cities within El Paso County, as well as the district attorney's office, the sheriff's office. And we developed a process of heavily focused on educating the community that are affected, the businesses, and providing technical assistance. Because if you can imagine that someone's livelihood is being so affected, and helping them interpret, what do we need to do here, and then enforcement as a last resort. But she helped us out with all aspects of that. But I can't say enough about Diana's leadership, her initiative, her strategic input. I have never worked with someone, on the legal front of Diana's caliber. And I can't say enough of wonderful things about you. And I will say, Yolanda, that, you and I were recognized as women of influence by the Colorado Springs Business. Diana was as well. Back, I don't know what year it was, but she was recognized as a woman of influence. But you're amazing, Diana. And we could not navigate our agency without you, your leadership, and your team, because I don't know if there's been over 100 different policies and changes and navigating, but we could not do it without you. So thank you. And I don't know if anyone else.
I do. I have a, Diana. Well, good morning. My previous interactions with lawyers, and it's been, it's interesting that we have recognized two of our great attorneys here this morning. But my interactions were typically along the line of, well, maybe we have a problem here, and I'd get a response sometimes, well, it depends, but not you, not you. You bring up things that we hadn't even thought of. And in fact, my interaction with you has typically been, well, have you thought about this, Dr. Sherbush? Well, have you thought about that? And I would say the word that most closely typifies what you've done for the Board of Health and for our health department is to anticipate problems, anticipate what we could do on a formal level, on a helpful level. And I just really appreciate that you've helped open my eyes to new opportunities, and I've learned from you. And so I just also want to sincerely say thank you for all the great work that you've done for the health department and specifically also for the Board of Health. Thank you. Thank you very much. Yes, Tammy, please.
Thank you. And this goes for you and Lori. I have the privilege of working very closely with you with you and with Lori on multiple projects for the county. And your official title is the county attorney. And I think in the last year, I always knew you were that, but in the last year, you actually became all of El Paso County's attorney. And the way that you and your team came alongside our businesses, we felt like as the Board of Health and as county commissioners, we felt like you were always right there to help us. But I have heard feedback that the businesses that you interacted with, the schools that you interacted with, the graduation ceremonies you helped put together and plan, the Olympic Museum opening, all of those people felt like you were theirs too. And you have indeed just gone above and beyond. And I'm so proud of you. I'm so excited for you. And really, I know you well enough to know that you're also about to defer a lot of things to your team. So, I know that you have rallied them and rallied Lori, and everybody in your office has has picked up different projects and somehow touched COVID public health response in some way, somehow, every single attorney in her office. So thank you for that. Thank you for building a team that was flexible enough to do that, flexible enough to let you carry the things that you needed to carry. And I'm just, I'm really excited. This is a well-deserved
Thank you.
public health champion.
Other Board of Health member comment, please. Go ahead and just raise your hand. That's about the only way we can tell.
Virtually.
Okay, do you see one? No? Okay, Diana, please.
Well, Cammie knows me well. Thank you for recognizing me. It means a lot to me, but although you're recognizing me, I feel like you're recognizing our office and you're recognizing kind of the effort that we've put in, whether it be, changing resources up a little bit, thinking a little bit outside the box, being available whenever is needed. A little funny, I kind of sometimes have a dry sense of humor, but Michelle's going to smile. She knows what I'm going to say. So we started getting into calling Friday. I called it Seago Friday. We would get public health orders that would drop on Friday at 5, 6 in the evening and businesses were scrambling. And so it's just been such a team effort, from Michelle to Deanne to Susan to, your communicable disease team. I mean, everyone has just pulls together to make public health in El Paso County shine, and that's what happened. The hardest part I've ever had in 24 years working for the county has been the most stressful time is this during the COVID time. I'm trying to, do the right thing, manage the office, meet the client's needs, but it's also been one of my most rewarding times. And the most rewarding part for me has been working with you all in the community on schools. I've always had a soft spot in my heart for kiddos and education and extracurricular activities. My son's lacrosse team just won state last night. So keeping kids, I know sometimes, it didn't seem like a priority, but sports, extracurricular activities, graduations, proms, those are the things that make a difference for these kiddos. Their mental health is just as important as their educational health. And you all in public health came right along with the whole team. Your schools team's amazing. Haley and Jenny have been fantastic. I know I saw Haley earlier, but Haley and Jenny were great. And thank you for letting me be part of your team. I was honored on how much you guys opened your arms and welcomed have you ever thought about, or what about? And even I think I would say sometimes, okay, I know this is a little bit outside my legal lane, but what do you think about? And so thank you for always being able to have an open mind and welcome the suggestions and partnering with the county attorney's office. So thank you.
Thank you.
Great. Okay, and EIS.
Right, emergency incident support, EIS. Mary Williams, if you want to come up, but you can all come up if that's okay. I think we probably have enough room over here, and then we'll take
We'll do the photos.
We'll do the EIS photo first after we recognize them as well. So EIS is a group of volunteers organized through the Pikes Peak Regional Office of Emergency Management to support organizations in responding to disasters or other emergency situations. Most recently, they fed all of our staff working at 20 of our COVID-19 vaccine points of dispensing from February 19th through May 14th. During this time, 126 EIS volunteers worked over 1,000 hours to serve El Paso County Public Health. They spent hours preparing homemade lunches and served all points of dispensing workers, nearly 2,000 total during 20 points of dispensing. In person, always with smiles on their face. The delicious food and hospitality was a bright spot during the long and often taxing points of dispensing days, and we are extremely grateful for your team support. And I do know that I have heard comments that the food is just really comforting and amazing. And I know when I went to the points of dispensing, actually at the South County building, we're calling it South Public, El Paso County Public Health, that I was just really greeted just with so much warmth. And I want to say it almost brought me to tears to know that people care that much. And I bring to tears now because everyone has worked so hard. And we appreciate you and your support, you lifting us up through just the food and just with smiles and just so much warmth. So thank you so much. And I'm going to ask my Deputy Director, Deanne Ryberg, to say a few words. She served as the Emergency Center Coordination Director with our teams, and like to give her an opportunity to say a little bit too, because she was highly engaged in all of the points of dispensing as well.
Thank you, Susan. And I want to echo those sentiments of gratitude for everything that you and your team have done. When we first opened our doors for our points of dispensing at our South location, there was so much that needed attention and needed to be done to be able to serve a mass vaccination event for the community and make that successful. And your team really was a force multiplier for us by being there to take care of the food, take care of our teams. We had the opportunity to focus our efforts where they needed to be focused, and also have that comfort of knowing that there were people there who cared about what we were doing and were there to support us to make that successful. And I know it has meant a tremendous amount to our team when they go in there and early in the morning for those pre-day briefings. And your team makes it so easy for us. There's breakfast, there's a warm welcome, and we're ready to start our day on a positive note. So on behalf of our team that staffed those events, we would just like to express our gratitude for making such a positive impact on those long vaccination days and making them a success for us. Thank you.
Super.
I don't know if any other board member has any comments.
Board of Health member comment? Go ahead and raise your hand. Out there? No? Well, maybe Michelle could organize this. We have a photo op, right?
Sure, Mary, would you like to say anything before we get started?
Yeah, so Emergency Incident Support is an all-volunteer organization in El Paso County, and we serve the first responders. And so we serve law enforcement, fire, active shooter events. We have supported the FBI and the Secret Service when they have been here. And when COVID came along, we viewed public health as a first responder. And we also view great food as being a tremendous morale and support to the first responders. And we like to be really engaged with the first responders. And it was a little bit of a challenge, but we have served in forests and in snowstorms and in rain and all kinds of environments, but we've never provided 100 meals to first responders in a facility where there was no stove and no oven. So that was one of our big challenges. And our goal was to provide great food and to welcome and support the people who were at the clinic. And it's our honor to support you, and we are always here to support you. And I would like to recognize the team of people. Many of them were there at 6 o'clock, 5 o'clock in the morning, and all night cooking food to make sure that we were taking care of you. And it was our honor to do that, and we are always here for you. Thank you.
Mary, could we do a photo of you accepting the award, and then we can do a group shot too? So we can have board members. We'll do the backdrop over here today.
Okay.
So, Mary, if I could have you.
We'll
in
take
the
probably
middle.
like a 5 to 7 minute break for photos and then come right back.
Sounds good.
Okay.
All right. If I could have you in the middle and
You want to
board
run it?
members.
Okay, board members, please.
Right.
Public health hero. Thank you. Yeah, let me scooch on this. I'm sorry.
Where do you want to?
The one that you got here in Puma. Of Mary. Yeah, the one I'm gonna have Susan between you.
Okay.
You think you want to do this?
That's perfect. Remember Dr. Norbert?
There we go.
Yeah, and could you go next to Dr. Turbush? Perfect. I got it. Yep. Let me see. We might need to squish a little bit more.
Want to go side?
So we're not squeezed in.
Do you want us to squeeze in or?
Yes, yeah, I think I'm just, with that, we
All
should
right, you can squeeze closer to me, Yolanda.
a little bit. Puma does not look too thrilled about that. All right, and then we'll just go ahead and take several. Perfect. All right, perfect. Thank you so much.
Thank you very so much.
Right.
Thank
And then we need to get her, Mary's team, yeah.
Yeah.
Let's
Thank
have board members
You
sit
guys want
down.
to come up in
Can
front
I
of the
have the
background?
EIS team, please?
You guys want to do a couple of rows.
Anything you need.
We're here for you.
Oh, wonderful.
Thank you. Let's see, so you guys might have to do we might have to do 2 rows for this.
Oh, we will, please.
Remember those having you up front a little bit?
I'm so glad someone's.
And then, sir, can I have you on the other side?
He bounces up.
Perfect, and can you guys shift a little bit to the left? Scooch down a little bit more. Sometimes it is very tempting, but.
You guys all need to be on this. so that-
Yes.
Here, there you go, there you go.
Perfect. You should be good.
Be behind this. There you go. Good job.
Yeah, super.
Perfect.
All right, that should. Okay, good. All right, I think we have everyone, so I will take several of these. And then Mary, I can grab your contact info and send you these. All right, thank you so much. Perfect.
And Mary, you had one more announcement, right?
Oh, yes. So it's our tradition, where are they? It's our tradition wherever we go to pass out Skittles. And so we have Skittles and we started this. We started doing this at the fire departments, and then the police heard about it, and they wanted it, and then the sheriff heard about it, and he wanted it.
Let's do Lori.
Okay.
Right, Dr. Booth, back up.
All right, Lori, if you want to.
Other class.
Oh, gosh. Yeah.
Sam, right here, bud. There you go.
Remember.
I think it's like the South building doing a positive cycle.
Just a little bit. They grow up. All right.
Oh, I didn't expect you.
Thanks, AG.
I'll take
I got one.
Narrow it down.
Thank you.
All right, board members, you can stay, and then Diana, I'll swap you. Nobody move.
That way.
I knew you'd have it organized.
These are the fun opportunities. Great development.
You did know that's yellow too. Oh.
Thank you.
Awesome. Yeah. Thank you so much, you guys, for coming. And
We're gonna.
Right. For us, we really appreciate it.
Okay, we'll take, thank you so much.
All right.
We need Yolanda back in here. Vicky, Yolanda back in. Let her escape.
I know we do need her. All right, so I'll do a few more of this with you, Diana. Ready?
Thank you.
Do it?
You did it, you're good.
Yes.
Thanks,
You're
Diana.
very well. So we just need, if you guys want to stay on just for
Yeah.
one second for Yolanda.
Yolanda, here we go.
Oh, yes, I grabbed. Okay, thanks.
Just cool pictures.
Yolanda and
Thank you, guys. You did.
Okay, Yolanda, if we can have you front and center in the course.
there we go.
Perfect.
That's gonna be a cute photo.
Move over. You think he's getting the award? All right, perfect. Okay, this should be the last one. This is nice. All right, thank you, everyone.
Right.
Thank you, thank you.
Yes.
Thank you.
Thank you so much. Thank you. Yolanda. Thank you. Ready? Good. And that's one of the happiest things we get to do. Let me just comment for the board members' sake. Thank you, Diana, Lori. Thank you, appreciate you. Mary Williamson from EIS commented several times that our public health staff are first responders. And I think it's important that we foot stomp that we reinforce that for the benefit not only of our staff, but for others out here who might look at public health as doing some other things, which we do. But we really want to be and are in that category of first responders. And it becomes increasingly evident that this is what we do. So along with the police, fire, ambulance, and others in the emergency response community, our public health staff are right there with you. So thank you.